Malaysia and certain time, and usually from Singapore and from Brunei is joined too. Today is very interesting. The term about the scope of health sciences. For you information, because the nursing college of lecturer is the first time join in the ASEAN lecture community event. I will to inform you that this event not confirmed. Therefore, there is no protocol strict like as the international conference. We are the will be to fun and enjoy for lecturing. Mr. Chu inform me, if you want to get more experience and knowledge, you must be to fun and enjoy. Okay, therefore only 5 itinerary. The first welcoming speak from me for the chairman of lecture communities. And the second, there is the short video of ASEAN lecturer community official video, only 3 minutes. And the third, we will to go the first speaker. Right now, if you look the name, this is Clara Chu, therefore, and Yuanita. The first is Miss Clara, and the second Mr. Chu, and the last Miss Yuanita will be to share. But Mr. Chu is know before. After the speaker, there is the song by video for refreshing for the participant, for the relax and fun. Okay, and then after all the speakers sharing, we'll go to the question answer. Therefore, the participant, you can to use chat box for you share question, and you can to share to my email address direct to. I will to share my email in the chat box as soon as possible before welcoming speak. And the fifth is the closing remark. Okay, right now let we start this event with the pray first with your religions. Silakan, please you pray first. Effective time. Nurse Hertuida Clara, Master of Nursing, Senior Lecturer of Pasar Rebo College of Nursing, Jakarta, Indonesia. Time if you know, but you must to remind that the time is 30 minutes to 35 minutes for you sharing. Miss Clara, time is you now.
Okay, thank you, Prof. Reza. First, I would like to thank you for the invitation for us to join these sharing lectures. And to be honest, this is the first time we are participate to this event. So this is our learning process, and yeah. So please forgive me if I can perform the perfect join or perfect presentation.
Right.
Okay, let's start. I will share my screen.
Yeah, you are the co-host right now. You can share.
Okay.
We'll start and very clear.
Have you seen my screen?
Yeah, very clear and nice. Look.
Okay, thank you, Professor, for the support.
Yeah.
Okay, today I will explain about my topic, how nursing to manage a patient in a case. So the first I will explain about the definition of a case. Yeah, I know some of you must know about a case. Yeah, Smeltzer say a case is a rigid external immobilizing device that is molded to the contours of the body. And the purposes of a case, there is 4 purposes. The first purpose is immobilization, and the second case for prevention or correction of deformity. And the third, the purposes of a case is to maintain, support, and protection to realign bone. And the last purposes, a case is to promotion of healing. There are various types of case. The first types is short arm case. Short arm case is the case applied extends from below the elbow to the palmar crease. And the second types of case is long arm case. Long arm case is the case applied extends from the axillary fold to the proximal palmar crease. The elbow usually is immobilized at a right angle. And the next types is short leg case. Short leg case is the case that applied extends from below the knee to the base of the toes. The foot is placed at a right angle in a neutral position. And the next types is long leg case. Long leg case is a case that applied extends from the junction of the upper and middle third of the thigh to the base of the toes. Okay. And the last types are body case and hip spica case. The body case is the case applied encircles the trunk, and hip spica case is the case that applied encloses the trunk and a lower extremity. So I will show you the picture of the one types of case. This is example of one of types of case series. It is a short arm case. You can see the short arm case applied, extends, start from below the elbow, and to the palmar crease, And the next, the picture show the types of short leg case. You can see the case applied below the knee until the base of toes. And this is the picture of case, long leg case, and also again short leg case. And this is the picture so that types of hip spica case. Okay, we next to potential complication. So we need to know what complication can happen to patient in a case. There are 3 potential complications related to case. Include one is compartment syndrome, and the second complication is pressure ulcer formation. And the third, patient can experience with disuse syndrome. And then we have to know what can nurse do assessment. It is important to perform frequent regular assessments to prevent case related to complication. Smeltzer have the assessment for assess the symptoms of neurovascular compromise. That is called by the 5P, and the 5P consists of pain, pallor, pulselessness, paresthesia, and paralysis. And also Black-Jacobs have the term the 6P mnemonic. So it's the same like Spencer. The 5P it's same. That is pain, pallor, pulselessness, paresthesia, and paralysis. But Black and Jacobs edit 1P, that is poikilothermia. So they have a 6P mnemonic. And so we have to know what the intervention for prevent the complication. Yeah, nursing intervention for patient with a case. They focusing on to 5 point, yeah, or 5 intervention. For the first is positioning, and the second intervention is ambulation, and the third intervention is exercises, and the fourth is nutrition, and the last intervention is self-care. So I will try to explain one by one from all the intervention. Okay, the first intervention, related to passive positioning tells about a case extremity should be elevated to minimize swelling. Yeah, and nurse must do frequent position changes. Yeah, because frequent position changes are essential to prevent complication of immobility. Then the second intervention, yeah, is ambulation. So the intervention of ambulation tells about client in case must to know that they don't need to worry, because client in case can often bear weight as soon the case is dry. So the patient no need to bed rest for a long time. Yeah, and related to ambulation, patient we have to explain that synthetic case can be worked on immediately after application, because many of patients may be worried, yeah, because they have something in their body, so they feel worried to work. So you have to explain they don't need to worry, because synthetic case can be worked on immediately, yeah, after application. And don't forget the nurse have to observe them closely, yeah, to prevent accidents when the patient start to ambulation or start mobilization. Yeah. So we have to take care with observe them, yeah, closely. And the next intervention about exercises, yeah, yeah, we have to explain to patient also, yeah, about exercise. Yeah, sometimes patient feel also feel worry, because maybe they worry about pain, yeah, because when they are start to or try to mobilization, the patient will feel pain, yeah, or the pain will rising, yeah. So we have to explain the exercise can apply to, yeah, for the joints above and below the case. So the patient no need to worry, because the area the fracture maybe we will not do move so only the joints above and below the case and then the nurse have to do exercise with isometric exercise because isometric exercises help maintain muscle strength so we have to maintain muscle strength with give the patient the isometric exercises and so we don't forget to give patient exercise full room exercises okay. And the next intervention is about nutrition. The intervention of nutrition tells about patient have to increase the dietary fiber and fluids, and also avoid gas forming foods, Then don't forget to well balanced diet, diet will well balanced to promote wound healing, And the intervention self-care, finally we have to teach patient how to do self-care, maybe about how they do skincare and how to prevent skin damage. Okay, maybe that is all my presentation. Thank you for the attention, and I hope my presentation give useful to all of you. Thank you, and I will give it back to moderator Prof. Reza. Thank you, Prof. Reza.
It's very interesting. Ayam is the new knowledge for me about nursing, but it's very interesting.
Okay, thank you.
A good presentation, and I think I am the first to get the new experience right now. Okay, ladies and gentlemen, I have to inform you before that after the first speaker sharing, we will go to the refreshing first before Mr. Chu will be to share the second speaker with the song by video of Indra Gumilang to share. For the student, I think because Mr. Chu informed me and informed us that there is the new friend from the Korea and another country in the connecting collaboration with ASEAN lecture community, and we can to look the song. Yes, very interesting for the younger. Indra Gumilang will be to share right now. For to refreshing first before the second speaker. Indra, what you want to share? I think Mr. Chu pun suka lah lagu ni. Okay, Indra, are you ready to share right now for the refreshing first before the second speaker sharing? Indra Gumilang, are you ready to share? Belum tampak lagi. Kalau belum, kita terus mau pergi ke Mr. Chu. But if you want to share the song for the refreshing, you can to reconfirm me. Mudah-mudahan student Pasar Rebo terhibur oleh Kang Indra Gumilang before we know you are the younger, therefore must be to dynamic dance and song. Okay, right now the another song but about the knowledge from Associate Prof. Chu. Please, time is you now, sir. Kita jemput Mr. Chu sekarang untuk sharing for the his. Mana satu orangnya?
Ada sini.
Oh, ada. Okay. Okay, very clear. Hemorrhoid made simple.
All right. Good morning, everyone. Thank you, Prof. Sharul Riza, for inviting me, giving me the opportunity to share in this session. So I'm going to share with you about hemorrhoid, which is very common. And I think we still commonly a lot of doubt about that. In medical world, we still have a lot of doubt about that. So what is hemorrhoid actually? It is one of multiple ailments that or diseases of the anorectal area. That means at the anus and also at the end of the rectum. Among the anorectal disorder, there are hemorrhoid, there are anal fissure, there are perianal abscess, fistula, anal incontinence, even constipation is a problem around that. So in picture, we can see here, anorectal disorder include all this. Hemorrhoid is only one of them. So what is hemorrhoid? So actually, it's just an abnormally dilated, otherwise a very normal vein. So what causes hemorrhoid? It is still a gray area in most of these medical profession. This one I quote from Association of American Surgery of Colorectal Surgery. So even though the cause is officially considered unknown, but there are multiple factors is believed to be the contributing factor. Aging, constipation, pregnancy, hereditary, straining for defecation, faulty bowel function, spending too much of time in toilet. Those are multiple factors. So let us understand the anatomy of it. Hemorrhoid vein is actually a normal part of the body. It serves purpose in the continence. So hemorrhoid vein actually is form a cushion for the anal opening. So it can make the anus watertight, airtight. So let us see in this picture, I make it in such a way. So in summary, actually, it is it's part of normal. So it is very common and it is associated with related to multiple diseases. So in the conservative treatment, we encourage increased water and fiber intake. The main purpose is to soften the stone so that we no need to strain so much. The main purpose of the conservative treatment is to soften the stone. Next thing, medication. We have this micronized purified flavonoid fraction. So this is the most common gold standard medication. Practically all the medication has a different brand, may have different name, but the ingredient is practically the same. So what is the purpose of this medication is to improve circulation, of the disease part. Then come to surgery. We have multiple surgery, starting from banding, infrared coagulation, hemorrhoidectomy, open and close. Open mean they keep it open, they don't stitch. Staple and hemorrhoid artery ligation, they ligate the artery and let us share me in the picture form. This is banding. What they do with banding is just constrict that part. And then coagulation, they burn or coagulate that part so that the blood doesn't flow. And or they do surgery to cut it off. And arterial ligation, they ligate or they constrict the blood vessel so that it doesn't move, the blood vessel stop going, so no blood flow. And stapler hemorrhoidectomy, or we call it PPH. This surgery actually, it just lift up the upper part. It's not the hemorrhoid part. It lift up the upper part. The hemorrhoid is pulled inside. And the extra part, just like a donut, has been removed. It will be removed from top. Over here, we can see it removed. So, and every surgery will have risk of recurrence. Beside complication, there are risks of recurrence. That means after surgery, it still come back. The treatment is not so successful. It keep coming back. So this is our pelvic floor, and you can see here is our normal anus. Our anus over here is hemorrhoidal bed is over here. This is the two bone that we sit on. This is a view from front to the back, AP view. That means we see the anatomy cross section from the front. So as what we know, hemorrhoid vein is normal, and hemorrhoidal vein form the hemorrhoidal bed. So that has purpose. So hemorrhoidal vein ultimately it joins the vein from the internal organs and go to the liver. So when we strain, when we relax, actually the blood pressure is quite relaxed. When we strain, normally before we strain, the blood flow is in this direction from outside inwards. This is vein, it's not artery. Artery from heart outwards, but this vein, it go back to the lung, go back to the heart. So it go inwards. But when we strain, intra-abdominal pressure will force to push the vein away outside the abdominal cavity. So what will happen to hemorrhoidal vein? It will engorge. That serves purpose. When the pelvic floor is healthy, when we strain, actually it engorges and it make it tighter, become waterproof and even gas-proof. So straining, or in medical term, we call Valsalva maneuver, straining. So straining, we strain. There's few types of situation that we create the increased intra-abdominal pressure. When we cough, when we sneeze, that is also a form of reflex, a form of straining. And when we defecate, when we pass motion, and also when we lift weight, this all involves straining. But there are differences. When we cough or we sneeze, we strain, intra-abdominal pressure increase, our upper end, that means our mouth open, but the lower end closed. But when we defecate, we strain, intra-abdominal pressure increase, our upper end closed. We don't open our mouth to vomit anything, but we relax the bottom to release content to the bottom. So the pressure of abdomen increase, but we force the content out downwards. Compared to vomiting, we increase the intra-abdominal pressure, we force the content upwards. Compared to weightlifting, we increase the pressure, but we close upper end and also lower end. So the main difference is during defecation, the pelvic floor relax. That is a problem when we strain over there. So when we pelvic floor relax, it descends. When it descends, there will be some amount of inner mucosa exposure. So when that exposure happens, hemorrhoidal vein exposed. When we strain, it tends to engorge. So repeatedly doing that, it becomes hemorrhoid. So if you look at that, these hemorrhoids, they are just a manifestation. They are not the cause of the problem. So the hemorrhoidal vein engorge is the manifestation of the problem. So what is the cause of the hemorrhoid? It is related to constipation. So constipation, and it is closely related to constipation. And constipation is due to what? Constipation is exclusively due to the posterior aspect of pelvic floor descent, according to this author. So actually, the main part of the constipation is actually contributed by the sagging of the pelvic floor. and like this. So when pelvic floor sag, it bend, it descend. So the bending will definitely give difficulty for stool to pass through. But when we have a softer stool, it's easier to pass through. So it's strained, and with the straining, with the descent, it causes obstructive type of defecation. It's not only the bending, also it may cause rectocele. So in medical world, when a person need to use their hand to support, we take this as a diagnostic criteria for a diagnostic of chronic constipation problem. So what the patient does is just manipulate and support to defecate. So what the patient does is like this. But this, for a doctor, it is a diagnostic criteria. But for the patient, it is a solution. It is a manual, it's a approach that they can solve their constipation without the need of medication. So, and this is another study. There is a clinical study done on women. They found that 96% of their constipation, obstructed defecation, improve with manual splinting. In this, the manual splinting refer to the pelvic floor support and the vaginal splinting. What is the pelvic floor support and vaginal splinting? And as what we know, the main component of constipation are due to obstructive type. Here, because of the band, and it also protrude into the vagina. This is in case of the woman. So, manual splinting, vaginal splinting include this. So, by inserting the thumb into the vagina and push backwards, that will help the defecation to be smoother. Another approach in the manual splinting include this. Just by manual splinting at the back, it improves the defecation. So, and there is also mechanical option of that. This is invented by a nurse in UK. She invented a spatula. It's just like a plastic, silicone or plastic device that insert into the vagina and push it backward. And there is another device, we call it bowel aid. It provides support on the back portion of the pelvic floor during defecation. This is incorporated into a toilet seat. This part is made of silicone. The whole toilet seat is just like ordinary high quality plastic, but this part is made from silicone. There's multiple clinical study has proven effectiveness of this simple device. And when we talk about hemorrhoid, let me share with you about hemorrhoid in pregnancy. This is the most commonest and is most difficult and it's very common. During pregnancy, there are few anorectal disorder that problem that interfere with this life of the woman during pregnancy. Constipation studies show about 11 to 38% of them have constipation. For hemorrhoid and anal fissure, it's up to 85% at the end of the pregnancy. That means at the 3rd trimester. And about 1/3 or 40% of the women during pregnancy, they have urinary incontinence. Why this thing happen? So during pregnancy, there is 2 major changes. One is the uterus size keep increasing. The other one is this progesterone keep increasing during pregnancy. When your uterus size increase, it will increase the intra-abdominal pressure to the extent that abdominal skin will crack. When the progesterone increase, it will cause vasodilatation. It dilates the blood vessel to increase the volume of the vascular volume. And it also, progesterone also relax muscle. It relax pelvic floor muscle with the pelvic floor muscle relaxed, it's descend. So when pelvic floor muscle descend, what will it cause? It will cause obstructed type of defecation, bending of the passage. You can see here, the blue color, these are the changes of normal physiological changes. But when it descends too much, it causes constipation. And with constipation, plus there is vasodilatation, that means the vein of the anus also dilate, and also intra-abdominal pressure increase, then it will cause hemorrhoid. The vein dilated. So with constipation, anal fissure will happen. It overstretch and tear. It causes anal fissure. Also because of the pelvic floor muscle relaxation, the grip on the urethra is loosened, so it causes urinary incontinence. So if you can see here, this picture very clearly, the main factor that contribute to all these three common problems is the descent of pelvic floor. And we know during pregnancy, we have limited option. We cannot give medication, we cannot do surgery because this is supposed to be temporarily. So how can we do anything to help this woman? Let us see later. So, and we know it is because of the constipation, and this is because of the descent of pelvic floor that lead to all these things. So we have conducted a study in AIIMS University in collaboration with hospital here, and we conduct a study comparing this cream therapy and also a mechanical device with bowel aid defecation to smoothen the defecation. In the control study, we use this hydrocortisone, which is commonly used during pregnancy. The best is to avoid because oral steroid can cause teratogenic. Topical should be relatively safe. But in the study group that we use is a bowel aid, a toilet seat with a support, additional support we call as HPS, to provide the support at the posterior aspect of the pelvic floor to smoothen the passage of defecation. So what we found in the study, we assess the pain, we assess the itchiness, we assess the swelling, bleeding, discomfort, and the well-being of the woman and the improvement. So what we found here, this is before, before, and this is after. You can see the study group is in green, the control group is in red, and we can see the pain is significantly reduced compared to the cream. The itchiness totally disappear, and the swelling is significantly reduced, and bleeding is totally disappear. Discomfort is significantly reduced and give them a very good well-being score. So this is a study we have done in AIIMS University to prove that actually just a mechanical support during pregnancy, it has a significant impact in management of anorectal disorder for the women. And in this study, we did not cover the urinary incontinence, and in other separate observation, it's improved in urinary incontinence too. So let us understand the whole thing. Constipation, no matter what is the cause, that will lead to straining. When you strain, the pelvic floor will descend. The descent will contribute to the bending of the passage that lead to obstructed type of defecation. And when anal mucosa is when the pelvic floor is descend, anal mucosa expose more. With the straining, the exposed part of anal mucosa engorge to become hemorrhoid. And with defecation difficulty hard stool with descent of pelvic floor, it may overstretch the anus, and the overstretching of anus will cause the pain and spasm. That is anal fissure. And descent of pelvic floor also loosen of pelvic floor during the loosening of the levator hiatus. That means the big opening, that the common opening for all the three passages to pass through. With the straining and descent of pelvic floor, it weaken and it descend to during pregnancy, it can cause urinary incontinence, but in the later part of the life, it can also cause incontinence, pelvic organs prolapse, and the rest of pelvic floor disorder. Then women has more of all these problems, especially pelvic organs prolapse, because women have pregnancy and delivery, and also aging and menopause. So if you look at this, all these diseases, which is currently named as a disease, actually they share a common root cause. So they look like a manifestation of a bigger problem. And the bigger problem, we call it as defecatory perineal disorder. This is a disorder of the pelvic floor disorder, a pelvic floor, which is related to defecation problem. So we call it defecatory perineal disorder. So with that, I conclude. So we propose the understanding of defecatory disorder, which descent of pelvic floor is the main cause. So with that, we can see how can this complicated problem can be solved conservatively. So because we believe prevention is better than cure, conservative should always be first and invasive is last. If you have any further inquiry, we are welcome to visit the informative website, Medical Made Simple. Here, I have compiled all my researches relating to how to make the complicated medical problem into conservative in multiple areas. And you are welcome to ask me, and you can approach me in the email too. Thank you.
Wow.
With that,
Yes, very interesting sharing. Prof. Chu, where I look your presentation, I remind while my wife in hospital, where my first children is born. It's very hard. I mean, to protection of hemorrhoid. Okay, ladies and gentlemen, before we go to the last speaker, we will to look the refreshing by song by video, because there is the song who Mr. Chu I think is very for the last speaker sharing. Please silakan. I hope you are the refreshing right now before the old song where we are in the school. Okay, nursing management and activity intolerance and fatigue is very clear screen.
Okay. Okay, thank you, Prof. Reza. Yeah, Assalamualaikum warahmatullahi wabarakatuh. Yeah, good morning, everybody. First of all, thank you for the opportunity given to me to present in this event with Asian Lecture Community. This time, I want to discuss about nursing management in activity intolerance and fatigue. Activity intolerance defined as a person having insufficient physiologic or psychological energy to endure or complete their required or desired daily activities. This can include a wide spectrum of individuals, from a pediatric patient to the elderly patient. Individuals that have experienced a decrease in activity in the past or previous intolerance are much more likely to experience this again. A variety of underlying conditions can cause and put a person at an increased risk of activity intolerance. The factors related to activity intolerance are imbalance between oxygen supply and demand, bed rest, weakness, immobility, monotonous lifestyle. With related clinical condition like anemia. Anemia can make someone face activity intolerance, and then congestive heart failure, coronary heart disease, heart valve disease, arrhythmia, chronic obstructive pulmonary disease, metabolic disorders, and musculoskeletal disorders. As a nurse, we must know what is a sign and symptom in a patient with activity intolerance. As a major sign and symptoms, subjective, the patient complaining tired all the time, and for the objective, heart rate increase more than 20% of healthy condition. If we know that the heart rate normal is 80 until 100 times per minute, so it could be more than 100 or more than 120. And then as a minor sign and symptom, subjective, dyspnea during or after activity, feeling uncomfortable after activity, feeling weak. For objective, blood pressure change more than 20% from resting. EKG picture show arrhythmia during or after activity, and the ECG show ischemia and cyanosis. As a nursing, we must do the right assessment for the patient, so we can know and we can identify that our patient have an activity intolerance. First, we can assess patient with the level of activity and tolerance to activity. This will allow the nurse to evaluate where the patient is beginning and then develop a patient-specific activity plan. Second, assess patient vital signs. This gives the nurse a baseline and way to gauge potential change and fluctuation in vital signs when active. 3, assess underlying cause of activity intolerance. This will allow the nurse to appropriately treat and underlying causes of decreased activity. 4, review medication lists. Some medication and the side effect may contribute to decreased activity intolerance due to tiredness and fatigue. Identifying this medication will then allow for substitution of an alternative medication when it's appropriate. 5, assess nutritional status. The patient body requires certain nutritional needs in order to be active. It is important to ensure that patient nutritional needs are being met. And then 6, assess potential need for assistive device with activity. Activity level may be decreased due to patient not having appropriate assistive device that available to them. Assessing if these are needed and then making them available can increase patient activity level or patient tolerance. 7, assess skin integrity frequently. We know that a patient with decreased activity level or intolerance activity are at an increased risk of developing pressure ulcer. Assess skin frequently is to prevent skin breakdown. As a nursing intervention for the activity intolerance, first, if patient is limited to bed rest, we can begin with a range of motion or warm exercise because it is important to adapt activity exercise to patient to patient current condition so they can improve their tolerance level. Second, monitor vital signs throughout activity. This is to ensure that the patient is remaining in a stable state throughout activity, and then provide supplemental oxygen therapy. And then the fourth, provide frequent position change. Patient that may be on bed rest or chair rest should be repositioned frequently to decrease the risk of skin breakdown. And then provide appropriate nutritional supplement when indicated. So the patient not malnourished, because if the patient malnourished, it could be more difficult for patient to increase the activity level. Okay, and then the sixth, utilize appropriate assistive device if needed. And mental work capacity that doesn't recover with rest. The factor related to fatigue are sleep disturbance, and then monotonous lifestyle, physiological condition like chronic illness, terminal illness, anemia, malnutrition, pregnancy, and then long-term care or long-term treatment program, negative life events, stress too much, and depression. With the related clinical condition like sleep disorder, infection, cancer, kidney disease, multiple sclerosis, autoimmune disease, hormonal imbalance, anemia, vitamin deficiencies, eating disorder, and then chronic cardiac condition and chronic respiratory condition or COPD. As a nurse, we must know the sign and symptom where the patient faced fatigue as a major symptom. Patient feeling the energy is not right, even though you have already slept, and feeling sleep deprived and complaining tired all of the time. As an objective, the patient unable to maintain routine activities and looking sluggish. As the minor symptom, subjective, patient feeling guilty for not being able to carry out responsibilities because their activity will change because of their fatigue, and then decreased libido. Of course, the decrease of libido will affect their sexual life. And for objective, increased need for rest. As a nursing assessment, first, assess current level of activity as it compares to patient's normal baseline activity. This allows the nurse to gauge the difference in patient current energy level and how the fatigue is currently impacting patient. Second, assess vital sign, and then assess lab value, assess full medical and surgical history, because patient may be fatigued due to a chronic condition or recent procedure. Identifying this will assist nurse in tailoring care and activity to meet the patient needs. And then 5, assess any imaging or cardiac studies. Review complete medication list because some medication may be the cause of the patient fatigue, and alternative may be available and need to be discussed between patient and the provider. The 7, assess need for assistive device for activity. As the nursing intervention, monitor vital signs and treat abnormal vital signs as needed, and then administer supplemental oxygen therapy as needed. monitor lab work and treat abnormal values as ordered by provider, and then provide appropriate assistive device for activity, develop activity plan, and then discuss with ordering provider the potential need for physical therapy or cardiac rehab program as appropriate, and treat underlying causes of fatigue as appropriate. The last, educate patient on lifestyle habit to improve activity and lessen fatigue. And this one, evidence-based practice for fatigue. Okay, we can do exercise to, sorry. Okay, we can do exercise, diet, and then acupressure, fatigue, exercise from Kramer and Swister, 2021. There is a type of exercise and how the exercise help the patient fatigue. Okay, first, walking or jogging. It can improve heart and lung endurance and decrease fatigue with consistent routine. And then weightlifting or strength. It can build muscle mass and improve muscle strength. And then yoga. It can improve flexibility and also improve general strength. And then swimming. It can improve endurance and easier on your joint. And then cycling or recommend bike. It can improve heart and lung endurance, decrease fatigue. And then this is the example of the exercise we can do to reduce fatigue. First, sit to stand. We can use our hand to push from the chair or arm, and then stand up tall before slowly returning to a seat position. And then remember that our seat is secure and not move out from us. So we will not march in place. Begin by standing tall next to a counter or a table, and then slowly lift one knee up to waist height. And then maintaining a tall posture, then slowly lower. And then alternate legs 10 times on each side. This one is step up. This can be performed by using the bottom step of your staircase if you have stairs, and then use the railing if needed for safety. You can step up onto the step platform with your strongest leg first, and then driving upwards so that your opposite foot can rise up to the step. Okay. Work up to 10 repetitions on each leg. Okay. The second after exercise is a diet. Okay. We can choose food with good source of calorie, protein, and fiber, and then eat small, frequent meals and snack. Improve fiber more than 30 grams per day, and then lower the add sugars less than 30 grams per day, especially in liquid, and then drink at least 8 cups of fluid per day. The last is acupressure. We can do acupressure to reduce fatigue in patient. There is 3 acupoint that we can use. The first is LE4 acupoint. This is on the dorsum of the hand between the first and second metacarpal bones, in the middle of the second metacarpal bone on the radial side. And then between the first and the second metacarpal in here. Okay. We can press in here until there is a soreness or pain. And then the second acupressure point is ST36 point in the tibialis anterior muscle, 4-finger atau 4 jari gitu ya. 4 finger of subject below the kneecap and 1 finger breadth of subject lateral from the anterior crest of the tibia. Okay, the last is SP6 point. Is located using 4 of the woman's finger width above the tip of the medial malleus. In here. We can use this 3 point of acupressure. Just press every point, just about 2 until 3 minutes. The first point, after that, the second point, and the third point is totally 6 until 9 minutes a day. But many research found that the 3 point of acupressure, LE4, ST36, and SP6, is effective to reduce fatigue in the patient. Okay, I think that's all from me. Thank you very much for attentions. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you, Bu Anita. Is very interesting sharing too. But for me, is very new knowledge. It's good sharing. Okay, we will go to question answer right now. Before tolong ini di mute dulu Kak Nida. And to okay. Once more, I want to read more.
Cannot clear.
Okay. Some quote unquote new mom afraid after her children get casting. Is the impact regard growth of children, leg or feet after recovery? This is the question. And second for Mr. Chu in the chat box, and there is indirect my email from Novi. We are often hear that hemorrhoid get because less or minimum eat of fruits and drink of water. Is it true? How the best lifestyle to protection hemorrhoid? This is the question for Mr. Chu, and the second question there is in the chat box. For Ibu Yuanita from Dian, about activity intolerance, there is my friend to start activity only 4 months after operation of heart attack. He said he is okay, but 1 month after that, he was dead. How many times a patient must be to rest before operation of the heart attack? Okay, this is the question in the email, and if there is the question in the chat box, you can to respond to. First, Miss Clara, first to answer.
Okay, thank you, Prof. Reza, and I will try to answer. There is no bad impact for the children after the case removed from the extremity. Even a case to help for healing fractures, because gips applied after the bone was reduced, or the physician do the reposition. So a case instead to maintain the reduced fracture, the fracture after the reposition, So the parents no needs to worry for their children. Yeah, there is no impact for the or lack of their growing. Yeah, that's my answer, Prof. Reza.
Okay. And then this different rather than the older person, right? I mean, the older person is very different than the children, because the children is the growth of the his I mean the structure of body and the right.
Yeah. Actually, the important thing is the physician do the good reposition. That's the important, because a case only for maintains the bone after the physician did the reposition. So even children have a good healing, yeah, from the older, yeah. So yeah, the parents no need to worry, yeah. I think, yeah.
Okay, right. Thank you very much for your smart
So
answer.
maybe we need to worry for the older, yeah, because there is maybe delayed union, yeah.
Yeah.
Okay, Professor.
Right.
That's
Right.
my
Thank you very
answer.
much for smart answer. And now, Mr. Chu,
You're
you can to
welcome.
respond the question in the chat box and the question who I have to read. Yeah. Yeah.
Yeah, just now I just confirmed the question. The question you shared was how to prevent hemorrhoid. Am I right? That's the question.
Yeah, Ahmad is the question direct to my email. He shared, we are often hear that hemorrhoid many person get
Prof,
hemorrhoid.
can you repeat the question again?
Yes, I repeat right now. The question from Nofi. We are often hear that hemorrhoid. Many person get hemorrhoid because less or minimum eat of fruit and drink water. Is it true? How the best lifestyle to protection from hemorrhoid? It is the question in email, and then there is the question in chat box too. You can to respond to question. Boleh? Are you use internet? I think okay. Mr. Cho informed me that his internet there is something wrong right now, but we can do waiting. Mr. Cho informed me before that there is a problem about internet in his office, I think. Okay. Before Mr. Cho coming, I think Ibu Anita, you can to answer first about the question for you regard the activity intolerance. Yeah, Facebook. Oh, no. Okay, Mr. Cho is come back, please.
Okay. So just now, just now when you read the question, I couldn't hear because of interruption on your side. Later, it become interruption on my side. I presume, how is the best way to prevent hemorrhoid? Am I right?
Yeah, right,
okay.
right.
That's but the reason I go into the detail of this presentation is we have to understand. Okay, sorry, I was mute. Yeah. So the reason is we have to understand the cause of the hemorrhoid before we know how to prevent it. So the cause of hemorrhoid, like what we have known, is contributed by many factors. But the mechanism that allowed the hemorrhoid to happen got to do with pelvic floor descent, which is because of aging of those things. So what we can do to prevent hemorrhoid is like take water, take fiber. Those are part of it. I think we all know. That is to help our defecation become smoother and softer so that we do not need to strain so much during defecation. So the main purpose is to prevent the straining during defecation. So either by taking more water, fiber, and the other thing that we can do is exercise, pelvic floor exercise. That will help to strengthen our pelvic floor. That is a natural way to prevent the pelvic floor from sagging down. And in addition to that, we can also use our hand to support from the back. That to facilitate defecation, that hemorrhoid will be taken care of. And definitely there are mechanical device in the form of toilet seat that we call it bowel aid. That will help to prevent straining during defecation. And I think that is the way that we can prevent hemorrhoid formation.
Yeah. Okay, thank you. Very smart answer. In the chat box, there is the question relation about you.
Yeah, just now in the chat box, there is one question from Malaysia regarding is constipation related to colorectal cancer? This is another interesting debate because in medical world, there are different school of thought. In the latest review, they deny that constipation is related to colorectal cancer. But there are people who think there are evidence to support constipation is associated with colorectal cancer. So my point is constipation is associated with colorectal cancer. You see, in our guts, we have from the mouth to the anus, we have about 6 meters. And among all the guts cancer, almost 80 to 90% is at the bottom. Especially the lowest most 1 or 2 feet, that account for about 70 to 80% of total gut cancer. It is lower part. So why lower part suffer the most? Because our body has natural ability created by God. It has its function to absorb nutrition. Those who are toxic, those are not healthy, and to be thrown away, it is feces. It to be parked at the bottom there. But the problem when we park too long over there, it got to create space for the next incoming stool. So there will be reabsorption of water to recycle the water. During that period, it will reabsorb toxic. And also because of the longer period of contact with the toxic, that it lead to gradually disturb the cells, and the cells become undergoing changes towards cancer formation. That is the reason why the lowest part has the maximum chances of colorectal cancer.
Okay. Thank you very much.
So I think we can have a different topic, a different discussion, and I will go detail about the evidence of this colorectal cancer and constipation. It's very interesting debate.
Yes. We will to create more about you. Another topic. Okay, Ibu Iwanita, you can to answer the question for you, and I think better you respond about Mr. Chu to coming your nursing college next year. Okay, Bu, silakan.
Okay, thank you, Prof. Reza. The first question is about
how many time to recovery after the operation for the heart?
Okay. It's about 6 until 8 weeks after the operation, and there is something that the patient must pay attention, like they don't work too hard and don't lift the weight, apa ya, benda berat.
Yeah, the high
Mix,
risk,
okay. Yeah.
Hmm.
Okay, and then they must pay the attention for the food, yeah, the nutrition food, and then can I mix, Prof?
Yeah, no problem,
Okay, ya.
because
Jadi
the children is no.
setelah operasi itu tadi kan sekitar 6 sampai 8 minggu tidak mengangkat benda berat, lalu tidak mengendarai kendaraan bermotor, lalu juga not having sex because it apa namanya, membutuhkan banyak tenaga kalau mau having sex itu. Jadi tidak boleh 6 sampai 8 minggu setelah
Very
operasi
high
itu,
risk.
jangan dulu, tahan dulu seperti itu.
High risk.
Like that,
Okay,
okay.
and the question in the chat box you can to respond for you.
The second question is about to minimize sleep disorder, yeah, in nursing management. Okay, we know sleep hygiene. Okay, we know sleep hygiene. Okay, sleep hygiene means that like first we must limit the consumption of the food and drinks before we go to bed, and we must avoid eating large portion before sleep. We must have the ritual activity before we go to sleep. So if we want to sleep at 11 o'clock, so at 9 or 10 o'clock, we must get ready to sleep, like that.
Okay.
Maybe like that, as a nursing management for the insomnia, we can do sleep hygiene.
Okay. Thank you. Now, I think Miss Clara, if you have interesting question you want to ask to Mr. Chu, you can to direct ask to Mr. Chu if you have the interesting question, Miss Clara. Please, no problem. The speaker will be to ask to the another speaker for the explore this interest topic for the student. Miss Clara, are you will to ask something question to Mr. Chu before we will go to the last session? Bu Clara.
On now, not yet, Prof. Reza.
Mungkin Ibu mau tanya program, what the nursing program in the IM is interesting for you collaboration, I think.
Yeah, just remind there is one question on the chat box, Prof. Reza. Can I answer? There is one question in the chat box for me.
Yeah, please, if you want to respond.
Okay, I will try to answer one question from our students, Ari Prayudi. Ari asked me about how can we know or identify that an infection has occurred in patient in case. That is the question. So I will try answer. Yeah, we have to be careful, yeah, with to the patient in a case. Yeah, there is a few signs to make sure or we have to assess if infection can happen or experience patient experience. The first, we have to make sure we will smell unpleasant odor of our case. Yeah, we must check closely to a case and smell unpleasant odor. Yeah, maybe in Indonesia we said bau busuk. Yeah, not good smell. Yeah, and after that we check the end of the case. Maybe drainage through over the case, yeah, or in the end of the case, maybe we see the dryness throughout, yeah. And we have to assess that patient have elevation of their temperature, yeah. Yeah, maybe patient tells they feel fever, yeah. Then we can cross check with assess with thermometer, yeah. Then there is one sign, important sign we call by hotspot, yeah. The sign of hotspot we can assess with place our palm, yeah, like this. Do you see my hands? Okay. We can use the palm of our hand, yeah, and we place the surface of case, and we move our hands, yeah, until the end of the case, and feel the surface of the case, yeah. We will feel hot spots, or we feel warmer than other areas, yeah. When we move our hands, yeah, we feel there is warmer, yeah, than other place. So maybe there is infection below the area, the warmer area. Yeah, that's a sign of one of sign the infection we called by hotspot. Yeah.
Okay.
Okay. That is my answer, Prof. Reza.
Okay, Mr. Su, there is the one question for you from Sari. He asked, right now is many young professional worker is stressed in his job. This is a dangerous for them about the hemorrhoid, or this is the normally situation only?
Oh, yang again, Prof. Riza, can you please repeat again the question?
Yeah, there is many young professional worker is the hard work and the stress. This is the stress is very stimulation for the hemorrhoid problem.
Yeah, yes, I think stressful life can cause hemorrhoid, but we have to understand how it linked to hemorrhoid. So because of stressful life, we are busy, we are rushing, and the first thing is we don't have time to pass motion. Wake up in the morning, have a quick breakfast, and rush and go out. So then we postpone, we delay defecation, and when the defecation is delayed, it got to compress, become harder, because the food keep coming in. So the more you delay, the more constipation you will have, and the more constipation, you will be straining more, then your pelvic floor will come down more during your defecation. More straining will engorge it and become hemorrhoid. So that is how it linked. It is not direct without mechanism. There is a link between this stressful life into constipation. You see, in urban life, it is associated with more incident of constipation and hemorrhoid, and also other diseases. In rural area, the chances is lower. I've read one article. It's a study comparing urban people in Bangkok and the rural area people in southern Thailand, and the risk of colorectal cancer is drastically different. So the risk of constipation also different.
Okay.
The incident constipation also different.
Okay. Mr. Chu, I
So
know
stressful life do indirectly lead to
Mm,
constipation
mm.
and also hemorrhoid.
Mr. Chu, I know you are
So I
have
hope
the
I answer
pattern.
your question, Prof.
Yes, I know you are have the pattern of your research about hemorrhoid protection. I hope you can to inform about it the another time to the nursing colleges in Jakarta.
Yeah.
But I think better you coming next time for the bring your patterns of product, right?
So actually for pregnancy, we should learn how to take care of pregnant women during pregnancy period so that they can go through the pregnancy period without constipation, without a hemorrhoid, without bleeding of anus, because practically we offer nothing to them. They only ask to take water, fiber, but still a lot of them suffering from that. So I think that is an unattended problem that we should address.
Oke, Ibu Yuanita, closing remark sekaligus Ibu mungkin bisa merespon apa-apa yang Mr. Chu sampaikan, bahkan mungkin menarik sekali kalau Ibu mengundang bersama teman-teman nursing lain karena beliau punya temuan yang dipatenkan untuk menghindari hemoroid bagi orang melahirkan. Silakan Ibu sekaligus closing remark, nanti masing-masing Ibu 2 menit, Ibu Clara dan Mr. Chu. Please, Bu.
Yeah, thank you.